Today we're going to talk about the history of vocal cord surgery, specifically all the major landmarks in the last 200 years that have allowed us to get to today's modern day techniques. Let's start back in the early 1800s with Professor Philip Bozzini. Philip Bozzini was a surgeon who did not specifically specialize with vocal cord or laryngeal surgery, but was critical in developing a light-guided endoscope, meaning being able to see with a light through a very dark tunnel. Seems pretty obvious now, but that dramatically shifted what's going to come in terms of being able to see the vocal cords down within the throat. The next one is Professor Manuel Garcia. Professor Garcia was really credited with being able to examine the vocal cords in an awake patient. Someone comes into the office wanting to see why they're hoarse. Professor Garcia was really the first one to look with a mirror through the mouth to look down into the throat to evaluate or understand what's going on with the vocal cords. We think about the traditional headlight of a old-time doctor. That headlight was used to reflect the light off the mirror, off the forehead, off the mirror in the mouth to look down into the throat. And that was Professor Garcia. Then working on Professor Garcia's work, Professor Morel Mackenzie in the 1860s then further defined the use of what's called indirect laryngoscopy, again, using indirect methods to look down at the vocal cords to examine ongoing vocal cord issues in the office. The true pioneer, or we say grandfather of laryngeal surgery, thinking about asleep patients, was really defined by Professor Chevalier Jackson. Professor Jackson is really credited with both direct laryngoscopy, meaning looking at the vocal cords directly within the sleep patient, looking through the vocal cords into the airway, thinking about foreign bodies, peanuts might get stuck into the trachea or the windpipe. Professor Jackson was the one to really understand how to get down looking at these structures within the airway and the esophagus. Professor Frederick Ortel really then built on the indirect laryngoscopy to examine and evaluate the vocal cords in the office by using a flashing light, what we call stroboscopy. Stroboscopy allowed Dr. Ortel to slow down the vibrations of the vocal cord to see where the issues of sound production were being formed. Number 6 is Gustav Brüning. In the early 1900s, around 1911, Dr. Brüning was able to start the process which we use all the time today of injection laryngoplasty. Injection laryngoplasty simply means to put in a filler within the vocal cord. This is mainly to address issues of vocal cord paralysis or inability to close the vocal cords to produce a sound. The ability to get something through a needle to fill up that space was a true break from what was previously available for patients, and now we use it all the time. The introduction of using a microscope during a vocal cord surgery with the direct laryngoscopy, which had previously been established by Professor Jackson, was really established here in the United States with Professor Hans von Leyden. Hans von Leyden was the one to really be credited with bringing the microscope so we can see the critical layers structure of the vocal cords. The vocal cords are very small, using a microscope making it very big, precise, exact surgery, allowing the best outcome. There are many surgeons who helped adapt the laser to the microscope of now we're using a microscope for vocal cord surgery. One of the major innovators of the use of laser was the Professor Wolfgang Steiner in Germany. He really is credited with use of the laser and the microscope during surgery to cure vocal cord cancer. Vocal cord cancer previously was really addressed through either early radiation techniques or open surgery like a total laryngectomy, or removal of the voice box. Professor Steiner changed our ability to really address vocal cord cancer through the mouth, removing it with use of both the laser and the microscope during surgery. I would put number 9 with Professor Nobuhiko Ishiki. Nobuhiko Ishiki, or Professor Ishiki, wrote literally the textbook in terms of framework surgery. When we have issues of the structure of the larynx or the voice box, really we all look to his work, defining not only the normal anatomy, but how we can adjust the framework. We think about treating things like vocal cord paralysis on a permanent basis, and other ways, particularly the basis for gender-affirming care, was really defined by Professor Ishiki's work. And number 10, with Professor Hiroshi Kashima, with the advent, or really the development of using the laser, which we have already seen being addressed for vocal cord cancer, Dr. Kashima, Professor Kashima, used this laser to create a hole for breathing. Why is this so important? Many patients cannot open their vocal cords and were destined to live a life with a tracheostomy or breathing tube. Now, with the use of the laser to cut that hole, it's called a laser chordotomy. Today, being able to apply laser chordotomy for patients without the ability of opening their vocal cords is a dramatic shift and development in laryngeal surgery. And with that, we have all 10 major landmarks in laryngeal history.